This is One on One. There she is on camera, Elizabeth Nikol, a senior integrated behavioral health clinician at Summit Medical Group. Good to see you, Elizabeth.
Thanks for having me.
One of your areas of expertise, depression. Define it, who deals with it, and how's it being dealt with?
So depression can show up in a lot of the ways that most people are familiar with, right? Sadness and sort of a lack of interest in the things that they used to enjoy. But then there are a lot of somatic complaints that go along with that, like exhaustion. People describe sleeping too much, sleeping too little. Sometimes people describe a difference in their appetite. They're eating too much, they're eating too little. Feeling like they can't focus at work, feeling like they're not as competent or motivated to get things done. And then, of course, in the worst case scenario, we're talking about people having suicidal ideation and really not wanting to be here anymore.
Depression. You know, it's not talked about a lot.
No.
To what degree is there still a societal taboo about depression?
I think there's still a societal taboo about mental health and mental illness in general. Yeah. So one of the things that I'm doing right now is working in primary care, actually, as opposed to in a therapy practice, to kind of help destigmatize getting help.
How?
So I will be brought into an exam room by a primary care doctor because that patient may have come in with a somatic complaint like headaches or their GI tract is acting up, but then they also start to share with their doctor that they're going through a divorce or their house is going to be foreclosed upon. And the doctor starts thinking, wait a second, I think something else might be going on here. But we know that if they simply hand a therapist's card to the patient, only 20% of patients actually follow through and call.
Why?
And well, I think part of it is stigma. I think part of it still in the society is I don't want people to know that I'm seeing a therapist. I don't want that in my insurance background. I don't want to run into somebody that might see me going into this particular building. And I think there's still an attitude that I'm strong enough, I can do it on my own. So by addressing it in primary care, the interesting thing about it is the doctor says, you know, I have someone on my team. I'm never called a therapist, who can help you work with different emotional stressors that you're having, difficulty in your family, troubles at work. Can I bring her in right now? This is of no cost to the patient, and most of the time, 90% of the time, they say yes.
Is that the term integrated medicine?
Integrated behavioral health, correct.
Explain it to folks.
So it's not something that's very new. It's been around for about 20 years, but I really think in the last 5 to 10 years there's been more studies in the literature. And it's basically using behavioral health personnel that are trained and working in a medical environment to be part of a team, usually primary care, but sometimes OBGYN, sometimes endocrinology, sometimes oncology, to actually just be there to field fires as they come in. Now, although this is great for the patient, it's also great for the physician, because let's say that you have 5 people waiting out in the waiting room and a patient comes in and they start to cry. That doctor has a choice of being there and being caring, which is certainly what they want to do, but it also means that they're going to fall behind for those other 5 patients that are waiting. So what they can do instead is say, wow, it sounds like you're going through a lot. Let us talk about your headaches first. And then I have someone who's on my team who can actually come in and talk to you about maybe some strategies that you could use to feel a little bit better. And so they're able to exit the room in a normal amount of time, and then I come in for the next 15 or 20 minutes and work on the other piece.
Now, your background is fascinating. You're a breast cancer survivor.
I am.
And we talked about this right before we got on the air. There is some degree of correlation between having cancer and depression.
Correct.
What is it?
Not only depression, I would say anxiety. I would say PTSD. I run 2 breast cancer support groups for our organization, and one of the things that we find is, especially when people reach the survivorship years, meaning they're no longer in treatment, and they're just going for their annual tests or their checkups with their doctors, and they feel like they're out on an island, and everyone else has kind of gone back to their normal life, but they're saying, I'm not okay. You know, I've just really been through something traumatic. I'm never going to be the same, yet I don't know what to do with all that I'm experiencing. So I'm really passionate about sort of survivorship programs and survivorship mental health, because I think during the actual diagnosis and treatment, these people have a lot of assistance and a lot of help, but sometimes afterwards there's not as much. So I've done a lot of therapy over the years with patients once they reach that survivorship mark.
Why do you care about this field so much?
I was brought into this field actually after 9/11. So originally I worked in downtown Manhattan.
You did.
For a large investment firm, and I was there on 9/11, and I was working in human resources. So I was already working with people, and I have always loved working with people, and I was a psychology major in undergrad. I thought at some point I might go on to be a therapist, but instead took a corporate route. And after 9/11, I watched therapists and social workers and people who did critical incident debriefings come in and meet with our employees. Luckily, we didn't lose anybody that day, even though we were right across the street. But people had lost family members, people had lost friends, and all of us were running from falling buildings. So watching people help really made me say to myself, wait a second, I need to be a part of this. There's something bigger. So I quit about a year later and went back to graduate school full-time, and then within a month was diagnosed with breast cancer. So at that moment in time, my mom, who was with me when I was diagnosed, said, you're somehow going to take all of this and you're going to put it together. So I was a patient for almost 2 years as I went through cancer treatment, and I really care about the patient's experience. And you know, I think we can do an awful lot for them to help it be better and more valuable.
Before I let you out of here, someone watching right now says, I know someone, family member, friend, pretty sure they're dealing with some form of depression, serious anxiety, but I don't want to overstep my bounds, you say?
Overstep. You know, there's too many people, unfortunately, that we lose to suicide. There are numbers like that reported in the papers all the time. And suicide is the worst case scenario for someone that's really experiencing depression or PTSD. But as soon as you see that something's not right with your family member, try and get them to talk about it. If they're not willing to talk about it, try to get them to engage and leave the house. Go out to the movies, go out to dinner, have a friend come over. One of the things we know is that activities are incredibly important when somebody's depressed, because people feel better when they're active.
Yes.
So I think any family member should just not give up.
Or friend.
Or friend.
Don't give up.
Don't give up.
Even if they tell you to mind your business.
Absolutely.
Elizabeth Nikol, Senior Integrated Behavioral Health Clinician at Summit Medical Group. You just helped a lot of people. Thank you so much.
Thank you for having me.
I have a feeling you're put around this earth to help people. Appreciate it.
Hope so.
Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, TD Bank, the New Jersey State Nurses Association, and the Institute for Nurses, the Healthcare Foundation of New Jersey, the Give Something Back Foundation, and by Cone Resnick. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.